1. A nurse on a telemetry unit is caring for a patient who reports chest pain radiating to the left arm, shortness of breath, and diaphoresis. What is the nurse's immediate priority action? Answer. Administer oxygen and initiate cardiac monitoring while notifying the provider. Rationale. Immediate priority is to improve oxygenation and assess cardiac rhythm to detect ischemia or arrhythmias, while also alerting the provider for further management. 2. A patient with an acute MI suddenly becomes restless, pale, and hypotensive. What is the nurse's priority intervention? Answer. Assess vital signs and prepare for rapid response activation. Rationale. These signs indicate possible cardiogenic shock or worsening infarction. Early assessment and team intervention are essential. 3. The nurse is reviewing the ECG of a patient with a suspected MI. What finding most strongly supports a diagnosis of an acute MI? Answer. ST segment elevation in contiguous leads. Rationale. ST segment elevation indicates myocardial injury and is a hallmark of ST elevation myocardial infarction STEMI. 4. A nurse is caring for a patient post-MI who is reporting new onset of shortness of breath and frothy sputum. What should the nurse do first? Answer. Assess lung sounds and notify the provider immediately. Rationale. These are signs of pulmonary edema, a complication of heart failure post-MI, requiring immediate evaluation. 5. A nurse is assigning care for 4 patients. Which patient should be seen first? 1. A patient with stable angina requesting pain medication. 2. A post-MI patient reporting chest pressure. 3. A patient scheduled for discharge. 4. A patient with controlled hypertension. Answer. The post-MI patient reporting chest pressure. Rationale. Chest pressure post-MI may indicate reinfarction or ischemia and must be prioritized to prevent deterioration. 6. A nursing assistant asks to assist with ambulating a patient 24 hours post-MI. What should the nurse do? Answer. Decline the request and explain that the nurse must assess the patient's tolerance first. Rationale. Early ambulation post-MI requires careful monitoring for tolerance and must be initially supervised by a nurse. 7. A patient who had an MI is receiving 4-nitroglycerin and reports a headache. What is the nurse's best response? Answer. Reassure the patient that headache is a common side effect and monitor blood pressure. Rationale. Headaches are common with nitroglycerin due to vasodilation. BP monitoring is needed to prevent hypotension. 8. A patient recovering from MI refuses to attend cardiac rehabilitation. What is the best nursing intervention? Answer. Explore the patient's concerns and provide education on the benefits of rehabilitation. Rationale. Understanding the patient's perspective can identify barriers and promote adherence through education. 9. A patient post-MI is prescribed metoprolol. What assessment is most important before administration? Answer. Assess heart rate and blood pressure. Rationale. Beta blockers can cause bradycardia and hypotension. Vital signs must be checked prior to administration. 10. A nurse is preparing discharge teaching for a post-MI patient. What should be the priority topic? Answer. Recognizing and responding to signs of recurrent myocardial infarction. Rationale. Patient safety depends on prompt recognition of recurrence, which can be life-saving. 11. A nurse is caring for a patient with chest pain unrelieved by rest. What should be administered first? Answer. Administer sublingual nitroglycerin as ordered. Rationale. Nitroglycerin is first line for chest pain due to its vasodilating effect, which improves myocardial perfusion. 12. Which task is appropriate to delegate to an experienced unlicensed assistive personnel? UAP, caring for a stable post-MI patient. Answer. Assist the patient with morning hygiene care. Rationale. UAPs can perform non-complex tasks like hygiene for stable patients, allowing the nurse to focus on assessments. 13. A patient with MI is at risk for dysrhythmias. Which finding indicates a need for immediate intervention? Answer. Sudden onset of ventricular tachycardia on the cardiac monitor. Rationale. Ventricular tachycardia post-MI can deteriorate into ventricular fibrillation and requires immediate action. 14. A nurse receives change of shift report. Which patient should the nurse assess first? 1. A patient 1 hour post-MI with new confusion. 2. A stable patient scheduled for cardiac rehab. 3. A post-MI patient requesting a sleeping pill. 4. A patient with controlled atrial fibrillation. Answer: the patient 1 hour post-MI with new confusion. Rationale: new confusion may signal decreased cerebral perfusion or hypoxia and requires prompt evaluation. 15. During an MI code, what is the nurse's priority during CPR? Answer: ensure high-quality chest compressions and coordinate with defibrillation. Rationale: high-quality compressions are the foundation of effective CPR and increase survival chances. 16. A nurse notices that a patient with a history of MI has a new S3 heart sound. What does this indicate? Answer: the patient may be developing heart failure. Rationale: an S3 heart sound suggests volume overload and reduced ventricular compliance, common in heart failure. 17. What is the nurse's priority when teaching a patient newly prescribed atorvastatin post-MI? Answer: teach the patient to report muscle pain or weakness. Rationale: statins can cause myopathy or rhabdomyolysis, and early detection of symptoms is critical. 18. A patient recovering from MI states, "I feel so useless now." What is the most therapeutic response? Answer: it sounds like you're feeling discouraged. Can you tell me more about that? Rationale: this response validates feelings and encourages expression, supporting emotional recovery. 19. A post-MI patient asks why they must take aspirin daily. What is the best response? Answer: aspirin helps prevent future blood clots that can cause another heart attack. Rationale: aspirin is an antiplatelet that reduces the risk of reinfarction by preventing clot formation. 20. A nurse notices a post-MI patient is not participating in care and avoids eye contact. What should the nurse do? Answer: assess for signs of depression and refer to a mental health provider as needed. Rationale: depression is common post-MI and can impact recovery, requiring assessment and early intervention. 21. A nurse is caring for a patient 12 hours post-MI who begins to complain of chest pain with each breath and pericardial friction rub is heard. What complication should the nurse suspect? Answer: suspect pericarditis as a complication of myocardial infarction. Rationale: chest pain with a friction rub indicates pericardial inflammation, which can develop post-MI and requires monitoring and anti-inflammatory treatment. 22. A nurse is caring for a patient post-MI receiving thrombolytic therapy. Which assessment finding indicates that the therapy is effective? Answer: relief of chest pain and normalization of ST segments on ECG. Rationale: thrombolytics dissolve clots and restore perfusion, indicated by pain relief and ECG improvement. 23. A nurse is providing discharge instructions to a patient post-MI. Which instruction is most important to reduce future cardiac risk? Answer: emphasize the importance of smoking cessation. Rationale: smoking is a major modifiable risk factor for MI. Cessation significantly reduces cardiovascular risk. 24. A nurse receives an order to ambulate a post-MI patient. What is the nurse's first step? Answer: assess the patient's vital signs and tolerance to activity. Rationale: safety during ambulation depends on hemodynamic stability and tolerance to activity. 25. A patient post-MI is prescribed lisinopril. What lab value should the nurse monitor closely? Answer: monitor serum potassium level. Rationale: ACE inhibitors like lisinopril can cause hyperkalemia, requiring regular monitoring. 26. A nurse is teaching a patient post-MI about diet. What dietary change should be emphasized? Answer: adopt a low-sodium, low-fat, heart-healthy diet. Rationale: this diet helps control blood pressure, cholesterol, and reduce cardiac workload. 27. A nurse observes premature ventricular contractions, PVCs, in a patient post-MI. What is the priority nursing action? Answer: assess the patient's oxygenation and electrolyte status. Rationale: PVCs post-MI may be due to hypoxia or electrolyte imbalance and can precede more serious arrhythmias. 28. A patient recovering from MI reports erectile dysfunction and asks about treatment. What is the nurse's most appropriate response? Answer: advise the patient to consult with a provider before taking any erectile dysfunction medications. Rationale: phosphodiesterase inhibitors can interact dangerously with nitrates and cause severe hypotension. 29. A nurse is caring for a post-MI patient who is anxious and asks, "Will I be able to live a normal life again?" What is the most therapeutic response? Answer: many people return to normal activities with proper treatment and lifestyle changes. Let's talk about that. Rationale: offering hope and education helps reduce anxiety and encourages recovery involvement. 30. A patient post-MI is scheduled for a stress test. What should the nurse do before the procedure? Answer: instruct the patient to avoid caffeine and certain medications before the test. Rationale: caffeine and some drugs can interfere with the test's accuracy and must be avoided. 31. A nurse is caring for a patient post-MI who has jugular vein distension and crackles in the lungs. What condition should be suspected? Answer: suspect the development of left-sided heart failure. Rationale: these are classic signs of fluid overload and poor cardiac output following myocardial injury. 32. What is the most important outcome to evaluate in a patient receiving beta blockers after an MI? Answer: evaluate for decreased heart rate and blood pressure without symptoms of bradycardia. Rationale: beta blockers lower cardiac workload. Therapeutic effect is measured by controlled vital signs without adverse effects. 33. A patient with an MI is prescribed morphine sulfate. What is the primary therapeutic effect of this medication in this situation? Answer: morphine reduces pain and myocardial oxygen demand. Rationale: morphine relieves pain and anxiety, decreasing cardiac workload and improving oxygenation. 34. A post-MI patient begins to complain of new, severe chest pain during ambulation. What should the nurse do immediately? Answer: stop the activity and assess vital signs and oxygen saturation. Rationale: new chest pain may indicate ischemia or reinfarction. Stop activity and assess to prevent worsening. 35. A patient recovering from MI asks when they can resume sexual activity. What is the nurse's best response? Answer: when you can climb 2 flights of stairs without symptoms, you may be ready for sexual activity. Rationale: this guideline helps ensure the heart can tolerate the exertion of sexual activity safely. 36. A nurse is preparing a post-MI patient for discharge. Which instruction is essential regarding nitroglycerin use? Answer: instruct the patient to take 1 tablet at the onset of chest pain and call EMS if pain persists after 5 minutes. Rationale: early EMS activation prevents delay in treatment if pain is unrelieved by nitroglycerin, indicating a possible new MI. 37. During a shift change, which patient requires immediate assessment? 1. A post-MI patient with chest tightness. 2. A stable post-op CAB patient. 3. A patient asking about medications. 4. A patient ready for discharge. Answer: the post-MI patient with chest tightness. Rationale: chest tightness may signal a reinfarction or complication and requires urgent evaluation. 38. A nurse notices a patient post-MI is frequently requesting pain medication and appears fearful. What should the nurse assess for? Answer: assess for anxiety or potential psychological distress. Rationale: psychological reactions such as anxiety or fear are common post-MI and can manifest as increased pain complaints. 39. A patient with a history of MI and heart failure is admitted with weight gain, dyspnea, and ankle edema. What should the nurse do first? Answer: assess for signs of fluid overload and review daily weight trends. Rationale: these are classic signs of worsening heart failure. Daily weights are a key measure of fluid status. 40. A post-MI patient asks about returning to work. What is the nurse's best response? Answer: return to work depends on your recovery progress, cardiac function, and stress level. Your provider will help guide this decision. Rationale: individualized assessment is needed based on functional status and the demands of the patient's job. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!